Health law is an exciting and dynamic field. It also requires a very specific kind of training.
It's extraordinarily complex. Health is the biggest industry in the United States.
It feels like some of these topics are really hitting us in the face, and we have to respond.
Excellence in health law is a result of excellence in legal education. And throughout its history, the UC Hastings College of Law has pursued this single-minded purpose. Through its programs, it's actively preparing the future workforce within health law, which enables its students to hit the ground running after graduation. In the heart of San Francisco, an ambitious law program is training the next generation of health lawyers.
Health law is a team sport, and so our curriculum is designed to prepare students for being leaders.
Health law is rapidly changing, and health law education is responding.
In health law practice, it's not enough to know the law, and so to be really effective in this field, you have to be a connector, a translator, a problem solver.
Sarah Hooper runs the health law program and the consortium, which links faculty and students with providers and researchers.
To learn what that feels like and to problem solve in an interprofessional way that is not just all of us working in our silos, but really thinking about complex problems in healthcare.
And I absolutely saw that play out in my first year or two in practice. It was amazing.
Julia Weisner graduated from the UC Hastings College of Law in 2014.
Hi, Sarah. Oh my gosh, it's so good to see you.
She is now a lawyer and compliance specialist.
I, every day, solve complex legal issues, regulatory issues, compliance.
And the learning never stops.
We're going to see disruption to the health law market and the way that we practice day to day, and our students will start preparing for that now.
Right now, one of the biggest challenges that I'm facing is just the changing healthcare environment and how to make change, how to deal with all the different complexities and concepts and social structures that we've created in how we deliver healthcare.
There's also opportunity for practical and more intensive learning.
We have internships and externships that are designed to give students on-ground experience in health law that connects what they're learning in the classroom to an actual site in the community, a provider group, a payer group, an agency.
That semester was a huge period of growth for me.
Professors are a key catalyst for student growth, energetically breaking down the growing complexities of health law.
Health is the biggest industry in the United States. There's an awful lot going on, from the technical side to the economic side, and every bit of it involves law.
Professor Rob Schwartz draws his energy from preparing and engaging a younger demographic in health law.
Yeah, it's fundamental, I think, because the issues are different now than they were a few years ago, and they're going to be different a few years from now.
Health law is always full of drama. We founded this health law program when the Affordable Care Act was being negotiated, and where we sit here today, there are big questions about the future of the Affordable Care Act and what's going to happen in the wake of COVID and what telehealth is going to look like, all of these questions. And the field is constantly changing, and we want to prepare our students to be able to adapt and to sort of thrive in that changing environment.
Leaders at UC Hastings call it experiential learning. Sarah Hooper sees it as a 360-degree picture of what's going on from the regulatory side, what's happening from the provider side, and from the patient side. The full circle of perspectives, allowing Hastings graduates to become leaders in the field. The UC Hastings programs are the kind we need to prepare future health law professionals for practice in a changing field. Constantly redefining legal education to leverage opportunities for the 21st century, and giving them the opportunity to prepare for positions while still in law school.